Hey there, I'm Dr. Frank Johnson from Sports Medicine Ultrasound. I want to demonstrate to you one of the more challenging injections we do and how to avoid some of the pitfalls. So the first thing is this hyaluronic acid product we have here is a combination of HA plus cortisone. And this particular product winds up being really, really viscous, which means if you try injecting it through the normal needles you use, you're going to, something will explode. Either your thumb's going to explode, the needle's going to come off, or actually the barrel, the chamber, actually sometimes the lure tip actually pops right off. 4 centimeters depth probably won't be enough, so let's go to 5. You know, I can see that pretty good with the linear here. Now what you can see is you can see the patient's elbows here. And if you were to take this elbow and drop it all the way down here, I don't like that position. I like this more sort of up against the body position. That's the first thing. What happens if we go a touch deeper? You know, I think this linear probe is going to do a great job, but just for comparison, let me double check before I start, because once you start, it's hard to change. Once you start the procedure, it's hard to swap. You know, I think I'm happier with the curve for this one. Turn on my brightness a bit. Okay, so your first challenge is getting the freezing down there. So this orange one, 2 inches should be plenty. A little bit in the skin, past quite a steep angle. You can see it coming in there. So right there, I'm touching the capsule and just a touch of articular cartilage, and that's flowing very, very, very well. Good. So that pathway is all set. Now, that I just proved to myself that the 2-inch needle is completely adequate. If it weren't, I'd circle back around and get a new needle. So now I'm going to use this 21 gauge by 2, and this will work fine for this product. Quite steep. In this case, I actually hold the barrel of the syringe for stability until I get it into a spot that I'm super happy with. And that spot I'm happy with. I start to inject. There. And this is a bit of a hard push, but we're succeeding. And there's nothing that's bouncing back off the joint and coming up superficial. There we are.